The World Health Organization is pushing countries to raise the prices of sugary drinks, alcohol, and tobacco by 50% over the next 10 years through taxation. Its strongest backing yet for so-called sin taxes to help tackle chronic public health problems and boost government health budgets. The United Nations Health Agency said the move would help cut consumption of the products, which contribute to diseases like diabetes and some cancers, as well as raising money at a time when development aid is shrinking and public debt rising. But not everyone agrees that increasing sin taxes is the right way to go. And one of those critics is David Clement from the Consumer Choice Center, who joined me in studio. So let's start with sugary drinks. What do we know about sugary drink taxes, and do they work?
So tried and failed is the simplest way to describe it. So back in 2019, I wrote about Mexico's experience with this. Mexico at the time, I think the obesity rate in the country was around 70%. And so they put forward a sugary drink tax to try and curb consumption with the idea of trying to slow down that obesity trend. Now, the actual caloric intake reduction, so it reduced the consumption of those drinks by 3.8%, which accounts for less than 7 calories per day per person. So not really any serious impact. And now some people may say, well, Mexico is different than Canada. We do have examples from Canada as well. In New Brunswick, they have a very unique policy program where if a party submits something for policy, they actually have to map it out completely. How much is it going to cost? How much is it going to raise? Things like that. So when David Kuhn, the Green Party leader, put forward this proposal, the average that they admitted in their submission was a reduction of 2.5 calories per day. So not really anything worth celebrating. Now, it's also not worth celebrating because these are consumption taxes and they're heavily regressive. And when I say regressive, it means the burden usually falls more so on low-income people. And that's exactly what we saw in Mexico. They had their tax, and 61.3% of the revenue it generated came from low-income Mexicans. And so we have to ask ourselves, do we want to tax the poor to lower caloric intake by 1/30th of an Oreo per person? Probably not.
Now, to go over to tobacco, I mean, we can both agree that the less people that are smoking, probably the better. But is raising a tax on tobacco the way to do that?
So this is one thing that I really, I would say policymakers have a hard time understanding is the answer to that question. Of course, you could tax a product until it was no longer affordable if black markets didn't exist. Right? And so what we have now is a scenario where in Quebec or Ontario, 30 to 40% of cigarettes consumed, not that we want anybody really to smoke cigarettes, are actually illegal. And so there is a point where people who do smoke just shift and buy illegally in the black market because legal cigarettes are so much more expensive. And that actually makes the problem worse because the reason why we have taxation on things like cigarettes is to recover healthcare costs. And when you buy illegal cigarettes, they're not taxed at all. And so you still have people smoking, but you haven't gotten any of the healthcare money back to cover some of the burden associated with smoking, cancer, etc. And so it's not a question of can we tax this product enough to get people to stop smoking when the black market exists and in some provinces it's 30 to 40%. So if you do go the route of just jacking up taxes through the roof, you're just going to see people shift to those illegal products. And then you're going to have budget shortfalls in those provinces because they're not going to be getting their healthcare money back.
And on alcohol, Canadians are already paying a pretty hefty amount for their LCBO purchases. But is there room for the price to go higher?
I'd argue probably not. So depending on the province, about half the price of a case of beer is tax. For a bottle of spirits, it's like between 70 or 80%. If we compare how alcohol is taxed in Canada versus the US. So for the average American, you buy a case of beer, it's around $4.12 in tax. For the average Canadian for the same case, it's about $20.31. So we're already paying egregiously more than people not far from where we live, people just across the border. And so, no, I don't think that there is really much room to go. But the problem with the WHO's view on this is they've said two things. We want to increase taxes to decrease consumption and raise more revenue. But it can't be both. Because if the tax is successful in decreasing consumption, that means people are buying less, which means you're generating less revenue. And so, and this is part of the problem when we have sin taxes is governments often get addicted to them. And well, what would happen in the let's say the province of Ontario if nobody drank? The province would be short billions of dollars because they generate so much revenue off of it. And so the WHO has to pick a lane. It either has to be, if they're suggesting this to the national government, to provincial governments, it's either to generate revenue, in which it's a tax grab, or it's to decrease consumption. It can't be both. You can't have your cake and eat it too in this instance.
Well, David, thank you for the time today.
Thank you.